Hi there, this is Steve Grady from Steve Grady Insurance Services, and today we're going to be talking about mental health, but not just mental health and our children. This is so near and dear to my heart. I've seen my own daughter have some struggles, and we have a good friend of mine, Dr. Emily Kierce, on the Zoom meeting here, and we're going to just kind of talk it out a little bit, and I'm sure she's going to give us some great advice. Thanks so much for joining me today.
Thank you for having me. I'm really,
Yeah,
really
I know you're
excited to be
crazy
here.
busy with your schedule and stuff like that, but I thought
We
it was
all are.
I thought it was so important. Just being a parent at home, completely stressed out, and I have my child I'm trying to take care of. I've learned that I'm definitely not a teacher. Okay, I'm not good at teaching. I have a whole new side.
Yep, we appreciate our teachers these days.
Absolutely, but
Uh-huh.
I just know there's a lot of stress. My daughter's having stress, anxiety.
Mhm.
I know there's depression out there right now. So I wanted to kind of talk to you. Maybe you could just give us a little background about yourself, and then a few questions I wanted to chat with you about.
Yeah, absolutely. First of all, thank you for having me. I'm excited to be here and be able to spread the word about mental health and, of course, children, because working with children and families is my jam. And so I'm really excited to be here. My first kind of endeavor as a professional was as a school psychologist. I trained as a school psychologist and I worked in Miami-Dade County Public Schools for 5 years. And then I entered a doctoral program for clinical psychology and I
Wow.
studied and became a clinical psychologist. And then after I graduated, I joined the Psychoanalytic Institute here in San Diego and got
Wow.
a postdoctoral certificate in adult psychoanalytic psychotherapy. So I have this kind of unique blend between school, clinical, and psychoanalytic thought that I tend to use with my children and families in my practice.
Awesome. And so is that your
Mhm.
main focus, children and families? Is that where you're?
Well, I work with adults as well, but absolutely my expertise is with children and families, and especially young children with disruptive behavioral disorders. I would probably say that's my best work.
Okay.
Hmm.
Yeah. And that kind of brings me to my first question. What are you
Hmm.
seeing with COVID-19 going on, the coronavirus? There's a lot of stress, especially in the family environment. What are you seeing out there, maybe coming through your front door, in your office?
Yeah. Well, a lot of my patients I've had for several years.
Okay.
So with those patients, I've kind of rode this wave of initially it was kind of like disbelief and we were all in denial, like, oh, we won't get hit with this.
Yeah.
And then there was this wave of like my parents that have college students that were particularly like, well, do I bring them home? And then guilt for not bringing them home initially, and then a week passes and we start shutting down and they try to get them home, and then to quarantine. And now I would say probably for the past 3 weeks, 4 weeks, it's really just been how do you stay well while in
Okay.
quarantine, and well, I mean psychologically well. Now I would have to say the new patients that we've taken in and the other psychologists in the office have taken on have been in distress about trying to find a provider that they could see in person,
Right.
because a lot of people are doing Zoom sessions and we are doing some Zoom sessions. But I think initially for our initial sessions and people who are really, really struggling with fears and phobias that are coming up, we've joined them in session, and there's some real symptoms that are interrupting work, people's capacity to relate and feel safe. So
So,
yeah, I would say we've seen an increase probably in panic
yeah. Yeah. And with
with
like,
our new patients.
yeah, in regards to kids, what do you recommend the best way to talk to your kids about this pandemic, or coronavirus? Because I know a lot of young ones are really just not understanding what is this. There's a virus outside. I don't want to go outside.
Yeah.
I don't know if you have any ideas of ways parents can talk to them.
Yeah, well, I think two things. I always tell the parents that I work with, no information at all is scary for kids because then it's left to their imagination. And too much information can be overwhelming. So finding a balance with just giving them enough information at a developmentally age appropriate, in age appropriate manner, I think is really important. So
Okay.
maybe if you have like young children or little kids, you talk about the importance of hygiene, washing your hands, using a tissue, covering your
Okay.
mouth, because germs are spreading and people are getting sick. And so we have to stay inside.
Okay.
When you have a middle schooler or a high schooler, you can start talking about data, flattening the curve,
Right.
and
Okay.
yeah, accessing things like that to give them
And,
more psychoeducation.
and so how do we like, with anxiety, what's our best route to, kind of ease our kids' anxiety? Or is there anything you would recommend? Or obviously, you know,
Yeah, well, many things, absolutely. Well, I think being honest, not overwhelming them, being a good model of self-care, structure in the house. I don't know how many families and kids I've said, get up in the morning, take a shower, and brush your teeth.
it's as easy as that. Yeah.
Put on jeans. Yeah,
Yeah.
put on jeans, because if day after day after the days start kind of blending together. So structure, I think, is really, really important. Being honest with them, again, open, asking questions, allowing them to ask questions, but also giving them space if they need space.
Yeah.
Some kids are trying to understand and process it, but reassure them that we're taking precautions to keep our community safe, and that the adults will protect you. I do think monitoring social media is really important, really, really important. I think just in general, but especially now, monitoring the amount of time on smartphones and video
Yeah. I
games,
was going to
because
ask you, like, how much screen time is enough or too much or too little, or,
yeah, I personally am not a huge advocate. There's a lot of effects and research just on too much screen time, and
okay.
children aren't thinking critically and they want this instant gratification. So in general, I encourage limiting it. But now especially, I think it's important to be doing activities, to have structure. Take this time take this time as an opportunity to, I don't know, learn a new language, read a book, talk about it, sit
Okay.
down, do arts and crafts with
Okay.
your family. Yeah.
So another thing, and then I'm just asking questions for my own
Yeah.
benefit
Yeah.
here. Sorry.
No,
Well,
that's all right. That's all
that's
right.
why we're here. No.
Sure.
So my daughter just does not want to do her schoolwork. I mean, it's like
Yeah.
pulling
Yeah.
teeth. I mean, we do it, but we're not finishing all of them. I've even had conversations with her
Sure.
teachers, and they kind of said tread lightly. I just wanted to kind of get your take on that.
Yeah, that's a great question. In general, I'm not a huge advocate of Zoom, whether it's therapy or academics. I mean, there's a lot lost, I think.
Yeah.
On the other hand, I'm really grateful that we have access to it. I have a lot of teachers in my practice, and they're working hard to really provide something that's interesting and kind of hands-on. But I have a lot of teenagers in my practice too, and they're like, forget about it. They're
Yeah.
doing all these like Zoom bombing, like people are like going into Zoom, like video bombing. And,
Yeah. No. I've heard of it. It's crazy.
And funny, but not really taken seriously. There are some schools though that are really, really strict with it, and some kids still are experiencing, I think, academic pressure. But for the most part, I don't think obviously the level of academic rigor is there.
Okay.
So as far as helping them achieve their schoolwork, I guess it would depend on what the school is requiring. Some are saying, if no matter what, your grade won't fall.
Yeah, that's what I'm hearing too, at least within the public school system. Yeah.
Exactly. So I would encourage some structure, at least a portion of the day, and maybe even break it up. Of initially you do maybe a math assignment or a reading assignment, and you make it fun, and then give them breaks throughout the day. You don't want them doing too much
Yeah.
and feeling overwhelmed, but at the same time, you want them to stay engaged.
Okay. No, that's great advice. I mean, yeah, that's really good advice. So is there anything else maybe you could, any other little tips that you could give us trying to get through this? We're starting to hear, getting back to work soon, and I don't know,
Yeah.
just your thoughts on kind of where we're headed.
Where we're headed, I don't know. I don't think it's not going to be a transition where we're kind of jumping back in the deep end, nor do I hope so. I am noticing I think that everybody's really come together to support the community, but I've noticed a lot of irritability in the community. People are coming out of hibernation,
Yeah.
and I think it's really important to maintain the distancing, to be respectful, to understand that everybody's having a different reaction to either being in quarantine, coming back out with or without a mask. And so being sensitive that I think this is a really difficult time for all, and trying to manage that, especially if you get someone that's reactive, whether you're at the coffee shop in
Yeah.
line or whatever it might be.
Yeah,
Yeah.
absolutely.
Yeah.
Well, this has been fantastic. I'm so glad like you joined me here. I think we should do more of these maybe in the future.
Sure.
It's really important to hear it from, the source, the expert. And I can't thank you enough for joining me. Is it okay if I give people your information, or
Yeah.
maybe you tell
Yeah.
us where we can find you?
Yeah, sure. Our practice is in East Village. I can be reached at by phone 619-537-9091, or by email Dr. Kierce, DrKIERCE @gmail.com.
All right.
Mm-hmm.
Awesome. Thank you again for
Mm-hmm.
coming, and we'll chat with you soon, I'm sure.
Yeah. Thanks, Steve, for having me.
All
Take good
right.
care.
Okay. Be safe.
Bye.